Abrasion. Definition. Abrasion is the pathological wearing away of tooth substance through some abnormal mechanical process. Site. Facial surface, root surface, incisal, or proximal. Causes of abrasion: traumatic occlusion, improper brushing technique, occupational habits such as holding bobby pins in between the teeth, tobacco chewing, tobacco pipe, vigorous use of toothpicks between the adjacent teeth, excessive mastication of coarse foods. Clinical features: V or wedge-shaped ditch, sensitivity of tooth. Treatment. Diagnose the cause of the presented abrasion. Correct or replace the iatrogenic dental work. Habit. Restorative treatment if habits are not broken. Abrasive lesions at non-occluding tooth surfaces should be critically evaluated. If teeth are sensitive, desensitize exposed dentin before starting restorative treatment is started. Restorative treatment.